everyone knows you need to recover from surgery, but how much you need to recover, it depends on how big the operation is and if there are any problems that happen at the time of surgery. So if you start someone at a healthy, good point, then clearly they're going to be at a better point after the operation. If you do a really large operation, obviously we're making an incision. There's a potential for your overall kind of physiology to get a bit of a hit, and that's the way we usually think of it, in that it's the equivalent of if you have an illness or something like that, you know that if you have a really bad flu, that you get knocked out, and recovering from that takes some time. Resting before surgery is the worst thing you can do, right? Because you could take an Olympic athlete, if you put them in bed for a week, they're barely going to be able to move. And most of our patients are not coming in as Olympic athletes, not at that moment. And they really need to get as active as possible. In terms of fitness, I make it really straightforward. I want people walking 2 miles a day. So that's kind of my number. And some people start at more than that. I say, well, I want you to keep doing that and do more. We expect people to do after surgery is to get up and walk, right? So it's the perfect exercise for what we're planning on having them do after surgery. There's plenty of studies, and it comes back to common sense, that if you get up, you start moving, you get back to your normal activity, that you will be functioning better and feeling better really quickly. And anybody knows if you spend a couple of days in bed, you feel miserable and your body just keeps getting more and more tired. So what we're trying to do is break that cycle where somebody has an operation and we say, oh, you need bed rest for 4 days. Well, then how do you get them out of bed, right? We're at the point where our patients are going home 4 days after major operations that in the old days they might have been in bed for 4 days.